Hello everybody, Chris from the Headache and Pain Management Centre here for your Tuesday for our Facebook Live, and today we're talking about a very specific topic on the lower back muscles and what impact those lower back muscles have on back pain and hip pain. If you're joining us, type in below and say hello. Happy to answer any questions as we are going through. So with those muscles of your lower back, it is basically the researchers into this is pretty settled on the relationship between the size of the lower back muscles and people with lower back pain. What that shows is that those muscles of the lower back, specifically the muscles that are called multifidus, they're deep to the spine and they're the deepest layer of those muscles of your back. Basically what they've shown is that those muscles become smaller, and instead of having muscle, like, you know, nice muscle fibers, nice muscle tissue in there, they become overcome by what we call fatty infiltrates. So instead of having a nice juicy bit of muscle in there, it's basically more like a marbled piece of steak. So there's a bit more fat in there, not as much muscle. And as a result, what happens is this is not as strong. So the muscles that are sort of in between each segment that connect one segment to the other, they're not quite as big, they're not quite as strong as what they should be. And as a result, what happens is that it's not able to stabilize, that's a bad word, it's not able to do the function that they should be doing. And basically what their function is to give input into your brain to say, hey, look, everything's okay, we're safe to do things. So as a result, what happens is that the back begins to stiffen up. So your brain, as a protective response, starts to stiffen the segments up so that you can't move quite as well. Now, the impact that this has on pain, well, this is the thing. Sometimes you can have an issue with muscles or joints or whatever and have no pain at all, but the predominantly people that do have pain do have these dysfunctions. They do have a smaller bit of muscle that's there underneath where it should be a little bit bigger, and it's not working quite as well. And as a result, you're not able to stand up as straight as what you could. It feels a bit of an issue getting out of a chair. So getting up, bending forward, and straightening up to get out of a chair. If you're an athletic sort of person, if you're a runner, a sports person, you can get predisposed to having hip injuries, hamstring strains, sometimes even calf strains as well, if the whole chain isn't all working properly. And if that chain is being, if the link in the chain that's not working properly is the lower back, it can give you some risks of actually doing some more damage, sort of disc injury. Sometimes people can get some SIJ things, or you can have the muscles of your hamstrings and your groins doing way too much stabilization for what they're able to handle. So you start getting injuries with your groins and your hamstrings. I guess what the take-home message is regardless of what it is that you've got, whether you're an athlete, whether you're an office worker, whether you just whether you're at home looking after the kids, even an older population going into the garden, it doesn't really matter too much. When you've got these issues with your lower back, basically it's because the muscles in your lower back aren't as big as what they should be. And basically what needs to happen is those muscles need to be bigger and they need to be stronger. The best way to strengthen a muscle is actually to load a muscle up. So one thing I say to everyone that comes in through here when we're trying to strengthen a muscle is that you're trying to get bigger, biceps or whatever. You're not going to lift a tuna can to get those muscles big. You're going to lift some weight. You're going to lift, 5 kilos, 10 kilos, 20 kilos if you're big enough. I wouldn't, but that's just the way it goes. You need to lift and lift and lift and lift so that it's difficult, so that it makes the muscles bigger. So when you're doing it with the lower back, you need to do the same thing. You need to load up the muscles of the back well to get those muscles bigger and stronger. So a common exercise that people do at the gym, for example, is deadlifting. But the problem with deadlifts is you've got a weight out in front of you, and it can be a little bit dangerous because you've got a weight that's out in front of you. You need to lift the weight and the lever of that to actually get the back getting going, and sometimes that can be unsafe, especially with people that might have a little bit of a disc injury or can be at risk of doing some injury. This here behind me is the Med-X extension machine. So there it is there. So what the Med-X machine does is it locks you in so you can't use any other muscles apart from your back muscles to do it. And as a result, what happens is that you're able to use those back muscles and strengthen them specifically so that you're getting the muscles bigger. Okay, and basically what what we do is we put people through a program where it takes 6 to 12 weeks to get the muscles, firstly getting them moving and activated again, and secondly getting them bigger so that you can get stronger and stronger. So it's easy to stand up, it's easier to do any of those athletic movements, and then you can add things in like your single leg squats, your deadlifts, or any other exercises that you might want to bring in forward. So I guess the take-home message is if you've got low back pain, you've got hip pain, it's not getting better, you've done all the different things to try to get that right, the thing that you need to look at is the strength of those low back muscles to see what's going on, okay? Because chances are if you've had this pain for quite some time, those muscles are going to be smaller, they're going to be infiltrated with fats, and actually need a bigger, more specific load to get those muscles bigger. Hope that's been helpful. If there's any questions about low back pain or low back muscles, just type in below low back pain. I'm happy to get in touch with you about your low back pain and hip pain to see what the best outcome would be for you. Hope you've enjoyed that. Tag, like, share underneath in the comments, and I will see you again next time for the next Facebook Live video. Take care, enjoy Tuesday, and bye for now.